Hi, this is Dr. Desmond White. Today I want to talk a little bit about insurance, okay? Actually, a lot of times patients are worried about the healthcare costs, not just about their medical condition. So most of the time when patients come and see me, they're on some form of an integrated shield plan, some local insurance. But healthcare costs and insurance claimability is still an issue, so they are concerned. So first, I want to say that before you see a doctor, you should find out how much they will charge you. Roughly, first consultation, 150, 200, maybe a bit more if it's complex. Follow maybe a little bit less, and most of us charge a similar amount. And for the patients with integrated shield plan, if they are admitted to the hospital, the hospitalization can be claimed as an inpatient consult. So endoscopy, colonoscopy are considered as inpatient, even though they are only a day surgery. So if someone come and see me for tummy pain that I think I need to do a scope, the scope is performed and the scope is done as in the day surgery case, then that will be claimable under most integrated shield plan. Then for the about 30 to 60 days before the admission, or up to from 3 to 13 months after discharge, usually they can still claim under the same plan. So integrated shield plan from insurance allow them to claim before the outpatient consult, about 1 to 2 months before the admission, for the procedure, for the scope, and also after the procedure, what we call post-discharge follow-up. But most of the time, the claim can go through when the scope patients. We need to make sure that there are a few things. First, we have to make sure that the indication is right. That means, for example, it's a young person with no alarm symptoms like bloody stools, black color stools, weight loss, anemia, short history kind of pain. A young patient means less than 20, 30 years old for a short period of time for pain, no alarm symptoms. If you scope them, people may question your indication for scope. So when we do a procedure, we want to be sure that there's a good reason to do that. If you have a good reason to do a scope, for example, someone sees me for persistent pain for more than 2 months, or someone sees me for, say, blood in the stools, or someone sees me for change in bowel habit in an older person, then doing a scope is reasonable. So first, when you see a doctor and the doctor proposes a procedure or admission, make sure it is reasonable in the eyes of the doctor. Number two is to be sure that you can claim, make sure that the procedure or the test that we have to do must be done in the hospital. Because when I submit claim for patient, the insurance usually asks, must she be admitted for this procedure? So there are patients that need an MI of the abdomen and they want to be admitted for MI or admitted for CT scan. And then the insurance turn around and asks, can this scan be done as an outpatient? Answer is yes. Most of the time, a scan can be done as outpatient. Scopes must be done as an inpatient because we need to monitor them before and after the scope. So if your if your admission can be done as an outpatient, then insurance may reject your claim. Number three is that if there's pre-existing illness, they also reject. For example, some patients may not be aware that when they buy the insurance, they have some abdominal discomfort. They declare, I have gastritis when they buy the insurance. So obviously, 10 years later, they want to check the stomach. The insurance will say, hey, you have a pre-existing illness 10 years ago when you buy the insurance. Now, it's 10 years later, you are coming to the same problem. This is a pre-existing problem, so you can't claim. So therefore, I told my patients, I do my best for you as a doctor. We give you the best advice, but you want to be claimable. Make sure that first, the reason for doing the procedure or the scope is reasonable in the eyes of a doctor. Number two, you have no pre-existing illnesses, pre-existing clause that preclude you from doing the procedure. And number three, should only two. Yeah, so make sure it is reasonable, make sure there's no pre-existing condition. Number three, remember, number three, make sure that the procedure needs to be done as an inpatient. It cannot be done as an outpatient. So if someone see me for blood in the stools, I scope them. It cannot be done as outpatient. Scope must be done as an inpatient. It's not a pre-existing condition, and the reason for scoping someone with blood in the stools are very reasonable. Usually, no problem. If you have in doubt, check with your insurance company, check with your insurance agent, see if they can give you some advice. And once they get admitted for the procedure, usually about a month or 2 months before the procedure and about 3 to 30 months after the procedure, they can be claimed. So I hope I highlighted something to you. You can help your insurance claiming in future. This is Dr. Desmond White. Thank you.